For many people, it can be embarrassing to talk about our bowels, even when there's a problem. But it is an important issue because over 36,000 men and women are diagnosed with bowel cancer in the UK every year. Now, the good news is that if the disease is found early, more than 8 out of 10 cases can be treated successfully. But the bad news is that too many people are diagnosed too late because they don't act on their symptoms in time. Now, this may be because they're unsure of what these symptoms are, or because they don't know what they can do to help prevent the disease. This short drama from the charity Bowel Cancer UK has been specially written for the British South Asian community to tell you about symptoms, risk factors, and the NHS Bowel Cancer Screening Programme, which has been set up to help detect the disease before symptoms show up. Screening is a very effective tool for identifying cases of bowel cancer and also in detecting small growths in the bowel wall called polyps that may turn into cancer if they're left untreated. We hope you'll find the drama an enjoyable watch and also informative, as it contains some very important messages about bowel cancer.
Did you know, in this country, bowel cancer is the 3rd most common type of cancer in men and the 2nd most common in women after breast cancer? Dad, I'm trying to talk to you. Tell him, Ma.
She's going to be such a fine doctor, isn't she?
First one in the family.
That's it. I've had enough of you two. I'm going to my room.
Why? What did we do?
I'm trying to tell you something important and you don't want to listen.
Woman, stop annoying the poor child. Sit down and listen.
It really is important, you know. Bowel cancer can affect anyone, but the risk increases as you get older, especially in people over 60. Now, do you know anyone that age?
Why do they call it bowel cancer?
Yes, why not bottom cancer?
Because it affects the end of your digestive system. Your colon, which is the large bowel, or the rectum. You know, the back passage. What happens is that as you get older, these little fleshy growths, polyps, begin to form in the lining of your bowel. Don't worry. Most people have them and usually they're harmless. Benign. You remember when Auntie Nita had that tumour and it was harmless? Anyone can develop polyps, but only some of them turn into cancer. But, and this is why I'm nagging you, if they are not discovered in time, they can turn into cancer, and then the cancer can spread into other parts of your body.
I think I need another cup of tea.
Me too.
It's not any one thing causing it, you know. There are different risk factors. For example, age. Vast majority of people that get bowel cancer are over the age of 60. So age is definitely a risk factor.
Are you calling your mother old, dear?
Polyps. Not always, but as I said, most bowel cancers start from polyps. If they start growing inside the bowel, they can become cancerous.
Why is it never a nice thing grows inside?
Happy's law.
Family history. Bowel cancer can run in families, especially if they've had a bowel cancer younger than usual, say before 45, or if 2 close relatives have had it at any age.
But we are a nice family, Nisha.
Medical history. For example, if you have type 2 diabetes or inflammatory bowel disease, which is basically inflammation of the intestines, or Crohn's disease, inflammation of the gut, you have a higher risk of developing bowel cancer.
I'm not inflamed. I'm as cool as a cucumber.
Diet and lifestyle. If you eat too much red meat, too much fat, too much alcohol, if you smoke, if you don't exercise and have a big belly, then you are at a much higher risk of getting bowel cancer.
Nice tea, dear. Very nice. Junk. Junk.
Hang on, what's
Bill.
that?
Junk.
It looks important,
Bill.
that's not junk.
Bill.
This is your FOB kit. Fecal occult blood kit?
Bloody test.
Yes, your poo test. You were supposed to receive a letter about this. An invitation letter telling you that you are now eligible for bowel cancer screening. Ah, you did receive it.
Nisha, darling, your dad and I spoke about this, and you are very right, and we will be more careful with our diet. But there is no need to, to touch our poo and stuff like that.
What's the big deal? You touched mine when I was a baby.
That was different, dear.
People scoop the dog's poo when they go for a walk.
And that's why we don't have a dog.
Tell her, Raji.
Darling, it's too complicated. As you said, we're growing old, you know. It's too much.
Why don't you just sit down? It's actually very simple and straightforward. For old people. When you've been for a poo, and you mustn't let it touch the water, take a stick. Scrape a bit off and smear it onto window number 1. Then take a fresh stick, scrape a bit off another part of the poo and smear it onto window number 2. And that's it. Then you repeat the action for 2 more bowel movements. Put it in the envelope and post it.
But how does the poo not touch the water in the toilet?
You can use a Tupperware container or a bowl or something that you can poo into. Take the sample with the stick and then flush the rest down the toilet as normal. So you don't actually have to touch it.
But doesn't it smell?
No, it's such a tiny amount, Mum. Plus, that's what the vacuum seal envelope is for. Even when it travels through the post, it's fine. But you must send it back within 14 days of taking the first sample.
And that's it?
Pretty much. Most people, and I do mean most, 98 out of 100 get normal results. So then, in 2 years' time, you'll get another routine screening and so on.
And what if we are one of those 2 people?
It's still not necessarily a big problem. Abnormal result doesn't definitely mean you have bowel cancer. It could simply mean that some blood was detected in the sample. So they'll probably do more testing, like a colonoscopy.
My friend Apunam had one of those. They put a long tube up his bum with a tiny camera on the end of it so they could see the inside of the bowel. Amazing.
Exactly. So basically, even if the result is abnormal, it still doesn't mean that it's cancer. It could be just hemorrhoids or something. So, was that difficult?
I think I need to do a poo.
Oh, Dad.
What's happening?
Papa is being a good boy.
What do you mean?
Prevention, dear. Prevention.
What are you talking about? You will get heart attack.
We can't control all the risk factors for bowel cancer, like age and family history, but we can take care of our lifestyle, can't we, Papa?
Yes, we can. And I want to be around to play with some grandchildren. Soon.
OK, mister. How do we reduce the risk of bowel cancer?
We don't eat English food.
Oi.
OK. We eat more fibre, more vegetable, pulses, more fruit. We eat less chips. We eat less red meat.
Well, it's easier when we are vegetarian.
Yes, but proper vegetarians, eating lots of fresh vegetables and pulses, and not just cheese and bread and pasta and pizza.
Oh, poor dear.
Very funny. And drink lots of liquids, especially water.
And?
Quit smoking and drink less alcohol.
Sorry, what was that?
And quit smoking and drink less alcohol.
So what are you doing on the stairs?
It's raining outside. I can't go for my half-hour walk.
Darling, there's one thing I don't understand. The screening every 2 years. But what if those polyps starts growing a year before of my screening?
Don't worry, Mum. Just be aware of any symptoms. You know your bowel habits. If they start to change, for example, if you get really bad diarrhoea for weeks, or if you see blood in your poo, or if you have pain or a lump in your belly, or if you start feeling really tired for no reason, then you go and see the doctor.
I don't have to go and see a doctor. I've got one in the house.
Well, you won't if you don't let me get on with this.
Although many of us have bowel problems at some time in our lives, most symptoms will not be cancer. But the message is, get to know your normal bowel pattern so that any unexplained or unusual changes are easy to spot. And if you're aged 60 to 69, do take up your invitation to be screened. Make sure you and your family are aware of the symptoms of bowel cancer. And if you notice one or more symptoms for more than 4 weeks, go and see your GP immediately. And when booking an appointment, remember, you can ask to see a male or female doctor. Bowel Cancer UK can help with information about symptoms, risks and prevention, and can also let you know if you're eligible for screening. Their nurses are on hand to answer any concerns or questions you may have, and you can contact them on this free phone telephone number 0800 840 3540. Or you can visit the website for more information.